Respiratory therapists are healthcare professionals who primarily treat patients with conditions of the heart and lungs. Some common examples include asthma, COPD, cystic fibrosis, and pulmonary edema. However, there are several secondary conditions that can also affect a patient's cardiopulmonary health, including chest trauma, obesity, near drowning, and burns. These aren't quite as common, although they can lead to signs and symptoms that negatively impact a patient's cardiopulmonary system, which is why these conditions are important topics for respiratory therapists, and that is why we created this video. So, if you're ready, let's get into it. First, let's talk about treating patients with chest trauma. Chest trauma is a term that can be used to describe any type of injury or trauma that occurs to the thoracic region. It could be caused by blunt trauma, falls, motor vehicle accidents, or penetrating trauma that you may see from a knife or gunshot wound. The treatment for chest trauma depends on the signs and symptoms of the patient. Some common examples include chest pain, shortness of breath, tachypnea, tachycardia, hypoxemia, and a pneumothorax. The next topic is obesity and treating obese patients. Obesity is a condition in which a person has an excessive amount of body fat in relation to their height. It can lead to a number of serious health problems, including heart disease, stroke, type 2 diabetes, and cancer. Nearly 40% of adults are considered obese, and obesity is the second leading cause of preventable death in the United States. This is why it's so important to understand how to treat obese patients as a respiratory therapist. One thing to keep in mind is that hypoxemia is much more prevalent in obese patients, therefore supplemental oxygen is often indicated. Obesity is also linked to a higher risk for obstructive sleep apnea, which can be managed and treated with CPAP therapy. Additionally, non-invasive ventilation is often indicated for the treatment of hypoventilation syndrome and hypercarbia. If intubation is required for invasive mechanical ventilation, it's often more difficult in obese patients. Next up is treating and providing respiratory care for near drowning patients. Near drowning is a condition that results when a patient is submerged in water to the point where they cannot breathe. This can lead to cardiac arrest, brain damage, or even death. Asphyxia is the most common cause of death in drowning victims, which results in cardiopulmonary collapse. Cardiopulmonary resuscitation, aka CPR, is the most common treatment method after a near-drowning event. Temperature management is also something that should be considered if the patient was submerged in cold water. Airway clearance therapy may also be indicated, including bronchoscopy, lavage, or prone positioning techniques. Most near-drowning victims develop ARDS. Therefore, the respiratory therapist must be able to recognize and treat the signs and symptoms. This usually involves mechanical ventilation with high levels of PEEP. The next topic is treating patients with burns. Nearly 500,000 people in the United States each year require medical treatment for burn injuries. While many of these injuries are relatively minor, some can be life-threatening. Burns can occur from a variety of sources, including fires, flammable gases, corrosive chemicals, electricity, radiation, and scalding water or steam. As a respiratory therapist, there are some considerations that must be made when providing care for burn victims. If a patient was injured in or near a fire, carbon monoxide poisoning is a common finding. Therefore, the patient should be treated with the highest possible FiO2 that is available. Initially, a non-rebreathing mask can be used to administer up to 100% oxygen, but the goal should be to place the patient in a hyperbaric oxygen chamber. Patients with smoke inhalation may also experience pulmonary burns within their airways. In this case, intubation and mechanical ventilation is required. If you enjoyed this brief overview, there are some other videos popping up on your screen right about now that I think you'll also find helpful. And if you want to support the channel, be sure to like and subscribe. I would greatly appreciate it. And just a quick reminder, we are not doctors. This video is for informational purposes only. Thank you so much for watching, have a blessed day, and as always, breathe easy, my friend.